So my name's Okey Okuzu. I'm the founder and CEO of InStrat Global Health Solutions, a mobile health technology implementing company in Nigeria, looking to push beyond Nigeria into other parts of Africa. I'm a big fan of Dimagi. We've worked on CommCare for a long time. So we see CommCare as a potent, probably the most potent primary data collection tool in the places where we work. So just for context, we work in very low resource settings. The people that use the systems in places where there's often no power and also no internet. And so in CommCare, we've seen a solution that's designed optimally for this environment where people, we have taken somebody who's never interacted with a mobile device and taught them CommCare in 30 minutes. In late February 2020, Nigeria had its index case of COVID. I think the index case flew into Nigeria on a Thursday evening and showed up in a city the next day, which was a Friday morning. So based on the experience that we had with Ebola as well as with methanol poisoning in the past, the two things that we thought that we could do instantly was first, ensuring that we had a mechanism to capture primary data so we could understand, the potential spread of the disease in the immediate environment. The immediate environment being all of the healthcare facilities in that local area. And the second thing was to equip the health workers with a more systematic, training program around COVID. In our experience in Ebola, health workers were totally ignorant about Ebola, and that led to needless infections and deaths. And so we thought that was important for COVID as well. And so, given our experience with CommCare, on that Friday afternoon, our team got together and picked up an electronic health records workflow that we had done in the past, uploaded that to CommCare, and then we did some really rapid research, getting information from the Nigeria Centers for Disease Control, the US CDC, the Africa CDC, as well as the WHO. We got succinct information from these places that basically allowed us to develop a very streamlined capacity, COVID-19 capacity building tutorial that we also then loaded on CommCare. And so we did this over the weekend. By Sunday, we sent the application to the Ministry of Health. They approved it. By Monday morning, we were in the field with a CommCare application. In Africa, I have seen an exponential growth in the level of development, by developing programming technology capability with young local professionals over the last 5 years. It has been, tremendous. The things that we're developing in Nigeria today are things that, there's no way we could have even contemplated that 5 years ago. And so with where we are today, the opportunity that that people must embrace, and if people don't embrace that, they actually would be missing out on that opportunity, is that local developers understand their environment, understand the nuances that have to be addressed in the technologies that are developed. By nuances, I'm talking about things like the infrastructure, things like the cultures, right? And so for global companies that are looking to, extend their technologies or invest or collaborate, there's, a huge resource pool that cannot be ignored right now. CommCare its strength is that almost anybody can customize CommCare to satisfy their intended purposes, right? And so almost anybody can can be a developer, right? I have recommended CommCare. We have used CommCare for over years in across dozens of projects and use cases, and I will continue to do that.